Hi, I'm Volk Vinall. I'm the chairman of pediatric dentistry at the University of Tennessee Health Science Center and the co-division chief of pediatric dentistry here at Bonheur Children's Hospital. I'm honored to talk to you today about pediatric dentistry and how it relates to TSC. The first thing is keep working at it. Try and make it part of a daily functional routine. It's a hard adjustment for children of all ages, especially those with special healthcare needs. And the more of a routine it becomes, the easier it is. Start young. Particularly with kids, right after they come out of the bath or shower, and they're all wrapped up in their towel, lay them down. You already have their hands down. They may cry. It honestly makes it easier for you to see and do what you're doing, and it gets them used to the process. So start young if you can. If they're older, don't give up. Keep trying, keep working at it. Use a mouth prop. There are devices that you can get from your dentist or you can buy online that can actually help you hold the child's mouth open while you brush. And really simple one you can use at home is actually a plastic doorstop. You can use a plastic doorstop and put it in the dishwasher if you have access to one of those. So use something that helps you get your child's mouth open so that you can do an adequate job of brushing. But it also gets them used to having somebody working in their mouth and gets them used to having their mouth stimulated in that way. There's plenty of tools that are available for parents who are trying to brush a child's teeth who may not be as compliant as one would hope for whatever reason. Obviously there's traditional toothbrushes, but if that's not working for you, there's what we call surround toothbrushes. Surround toothbrushes are toothbrushes that actually brush on all three sides at once. So you can get these from your dentist, but they actually go right over the tooth and they get all areas of the tooth at one time. So with one pass, you kind of get all areas of the mouth. There is also mouth props. So we talked a second ago about mouth props you can put in their mouth, but there's also foam mouth props that you can get that you put in sideways and you rotate, and those can help hold mouths open. And fluoride. Fluoride is our bread and butter of dentistry in general. It fights cavities, it helps re-harden, soften tooth structure, and it is important. If we can't get it on with a toothbrush, then a wet washcloth is not an equivalent opportunity, but it is better than nothing. So a wet washcloth to wash off some of the bacteria on the mouth and apply the fluoride is a great technique. If we can't use fluoride, baking soda. The pH of baking soda will raise the pH in the mouth, and that'll help fight cavities as well. So there are plenty of tools that we can use that if brushing doesn't work, we want to be trying our best to prevent cavities at home. So children with autism can have an especially difficult time with dental appointments. We know that. There's many things in the office that can be intimidating to them or trigger them feeling uncomfortable. We know that children with autism tend to have different concerns or issues with different sensations and different sensitivities. Some of them can be light, some can be noise, some can be sound, and we have all those things going on in the dental office. So allow whoever it is you're going to see to know in advance that your child has an autism diagnosis and help them know what might help your child. Is it an early in the morning appointment? Is it a later in the day appointment? Is it a dark room? Is it sunglasses? Is it quiet or headphones? Or a heavy blanket? We have the lead apron for x-rays we can place over your child to help soothe them. So there's a lot of different techniques within the office that we can try to help your child. But a lot of it goes with preparation at home because such children with autism like structure and appreciate structure. So a storyboard or a comic book at home that explains what's going to happen in the dental office from the time that they leave the house, the time they get to the lobby, to the time they go back to the chair and have their exam and get their teeth brushed, and the time they go home. And we can do our best to follow that step by step so the child knows what to anticipate. Sometimes even simpler than that, just having visits to the clinic without having treatment done. Just come in and see what the clinic's like and walk through and leave, and that may be our first appointment. Or maybe your first appointment is simply driving to the driveway and seeing the building and turning around and leaving. But preparing that child as slowly as possible in a way that is conducive to how they respond best. And that's something your provider can help you with. So the best place to find a healthcare provider to treat a child with special healthcare needs, or really anybody with significant special healthcare needs, is probably going to be a pediatric dentist. Pediatric dentists go through additional residency training, and it's hospital-based to treat people with medical special needs. And the best place to find a pediatric dentist near you is the AAPD's website, the American Academy of Pediatric Dentistry's website. It's aapd.org. And you can search by region or geographic area to find a pediatric dentist near you. All children with special health care needs, certainly TSC included, can have a hard time with dental care or health care in general. And the key to it is to be consistent, to do everything we can to be preventing at home. It is, we fully appreciate the difficulties of trying to have a child at home with special health care needs who doesn't want to brush their teeth. But it is truly important. We don't want children in the office who require extensive needs, if at all possible. It's much easier to try and prevent them as much at home. So imparting a regular brushing schedule and a regular routine and doing it nightly. And we see that with time, children of all special needs tend to become more accepting of it and to be more welcoming of that, not only at home, but also when they do have to go to the office and have health care and have oral health treatment done. They're more accustomed to having people work in their oral cavity, and so it makes our job easier when they come to us. We also know that children with TSC especially have potential medical comorbidities that can be conducive to causing some dental issues. Children with autism or children with epilepsy. There are medications they tend to be on. ADHD medications and anti-seizure medications can both cause dry mouth in some individuals, and that's another situation that can cause cavities to happen more quickly and become more extensive, and another reason that is extremely important that we are preventing them at home and also having regular visits at the dental office so that we can be catching things early.